The information in this podcast episode is for general information only. This is not medical advice. If you have issues that you need to address, consult a healthcare professional. Again, consult a healthcare professional for any healthcare concerns you may have. Welcome to the Perrysburg Podcast, episode 98. I am your host, Perrysburg resident Kim Newlove. The Perrysburg Podcast is a resource for Perrysburg residents. We talk about what's in Perrysburg and why people like to live here. Our website is perrysburgpodcast.com. We are talking about how to be a patient in Perrysburg today. This is part 2 in my 4-part medical series. Here's a little bit about the series, just in case this is the first part that you've listened to. Part 1 was back in January, and it was about Prime IV Hydration and Wellness, which is a business here in Perrysburg. If you missed my conversation with the owner, Shannon Cazel, and her lead nurse, Chelsea Honsberger, listen to episode 78 of the Perrysburg Podcast, and you can catch up on the conversation. Today is part 2 in this series. I'm calling it How to Be a Patient in Perrysburg because we're talking about healthcare for humans. Humans as opposed to pets. Part 3 will be in September. It's about pet care. My family is adopting a Labradoodle, by the way, in September, and I am interested in learning more about pet care and pet services currently available here in Perrysburg. Our golden retriever passed away back in 2017. It has been a while since we have had a dog. So I'm interested in pet topics. I'm looking forward to the September episode. And then part 4 will be about pharmacies. Why pharmacies? Because I am a pharmacist and October is American Pharmacists Month, so we'll be doing part 4 about pharmacies in October. That does it for the series overview. Now let's get started with a story. When my family was house shopping here in Perrysburg back in 2006, we still lived in Toledo, but we were house shopping here in Perrysburg. And finding a local healthcare provider for any of us was not top of mind. I wasn't looking for a new primary care provider. I wasn't looking for a new pediatrician. We needed a house first, right? So back in 2006, like I said, we lived in Toledo. My husband and I both worked. We had a big yellow Labrador retriever named Chewy, and we were raising toddlers. We were busy. Our boys were 1 and 3 years old back in 2006. Life was beyond busy. Work, family, all the things. We didn't have time to doctor shop, and the internet was not then what it is now, so we couldn't just Google things or look into our insurance's online portal for guidance. So we did nothing. When we finally moved from Toledo to Perrysburg 1 year later in 2007, none of our providers were in Perrysburg. We still hadn't thought to change things over, so in some cases, it ended up taking years to find new providers closer to home here in Perrysburg. Sure, life would have been easier if we would have just planned ahead, but finding new providers is hard. I mean, it takes a long time. It would have been much easier to not have that 30-minute drive each way to the pediatrician when the kids were little. In 2007, my kids were 2 and 4, and if you've raised kids, you know how often they go to the doctor. It's not just the annual well check. If they get sick or they get hurt, they have to go to the doctor. It was 30 minutes each way, and you have to park, get out the stroller, walk them into the building, take a bathroom break. You know, it's all the things. But the discomfort of driving 30 minutes each way motivated us to figure things out. And in the end, some providers were worth the drive. Other providers were replaced with providers closer to home. And now that our kids are adults, I have a 20-year-old and a 22-year-old. Our remaining pediatric providers in Toledo have been replaced with providers for adults here in Perrysburg. When you find a provider you like, it can take years to let them go. It took me years to let some of them go. We didn't end up leaving some of them until the kids were adults. For example, we went to Sylvania Pediatric Dental Care until the kids got discharged due to age. They were both 18 when we were told, hey, it's time to find a dentist that helps adults. And that subtle nudge, pushed us to finally get a new dentist for the kids. One of my kids goes to a dentist here in Perrysburg, and the other one actually goes to a different dentist in Toledo because he has special needs, and going to a dentist that can serve his needs was the right choice for him. Now that I have been living in Perrysburg for 18 years, I have experienced the challenge of replacing providers who have moved away from me or retired. So we'll talk about that too. Whether you're thinking of moving here or you've been here for a while, I think you'll learn something from this episode. I know what it's like to be a patient in Perrysburg, so I'll tell you what I know. Now, where to start? Oh my goodness, healthcare in the United States is complex. Let's just focus on being a patient. You are not technically a patient unless you're under the care of a healthcare provider. Even if you're healthy and you don't take any medications, you need a primary care provider. A primary care provider throughout this podcast episode will be abbreviated PCP. So just keep that in mind. Primary care provider is a PCP. It isn't just a doctor anymore. Primary care providers, or PCPs, can be doctors, nurses, nurse practitioners, physician's assistants. It could be your nurse midwife if you're pregnant and you don't have a primary care provider. There could possibly be others out there, but you get the idea. Your PCP will help you manage your health and your health challenges. My advice, don't Google stuff and ask ChatGPT in place of a knowledgeable human provider. There is no substitute for a human with training. Being a patient can be hard. It's no joke. You have a lot to keep track of and communicate to your provider or providers, and you're responsible for your own health. It can be a daunting experience to be a patient, right? If your health literacy level is low, meaning you're not a medical person and you do not understand medical jargon, you might struggle to keep track of everything. Your medications, your health conditions, your vaccinations, all the things, surgeries, health history. That's why it's important to team up with a primary health care provider so you don't have to go it alone. Get a primary care provider. Now, if you don't have a primary care provider, there are lots of them in Perrysburg. Finding the right primary care provider is the challenge. You need to find one who's taking new patients, and that will take some effort on your part. You'll have to call around. If your health insurance plays a role in who you choose as your provider, you'll have to do your homework on that too. I know I'm full of good news today, right? But doing your homework is part of being a patient. Keep in mind that Perrysburg also has concierge providers. No insurance is required. They don't even take insurance. You just pay out of pocket and you get access to a concierge provider. It could be a doctor, a nurse practitioner, same deal as we talked about earlier. It doesn't have to be a doctor. If you can't afford a doctor, that doesn't mean you don't need one. So try the new clinic at Perrysburg Heights Community Center. I'll put a link to that in the show notes. There are free clinics in Northwest Ohio. No matter who you go to or how you pay, start with an annual well check. That means your first appointment is when you're healthy. Then, if you get sick, your primary care provider already knows who you are and your health history. Taking care of you, even though you're sick, will be easier for both of you because you've met before when you're healthy. So start with an annual well check with your primary care provider. Now comes the hard part. You need to keep track of your health information. I recommend you keep a binder or a notebook. Imagine you're coming from out of town, you're meeting with a new provider for the first time. They don't know you, they don't know your previous provider. You need to keep running records as the years go by so you can share that wealth of information with your new PCP. Anything you see on a new patient intake form, go ahead and Google it. Anything that you see on a new patient intake form is what you should be keeping track of through the years. Because if you become a new patient, your new provider, whether it's a PCP or a specialist, will ask you about it. You'll have to tell your new primary care provider or your specialist about the following. I've developed a list here: your health conditions, whether you've got asthma or heartburn or whatever you've got, you'll have to tell your providers about your health conditions. You'll have to tell your provider about pharmacy information. What's the name, address, and phone number of your pharmacy? Do you go to more than one pharmacy? Do you have mail order for your chronic pills or your inhalers if you have asthma? Do you have a compounding pharmacy that you go to because maybe you're a man or a woman who needs some hormones compounded? Always have your pharmacy information and share it with your providers. Also, share the medication list. I am a pharmacist. We always recommend that people have a medication list. Whatever you take for health reasons, you need to tell your primary care provider or any provider really about it. This could be prescription drugs, over the counter drugs, herbals, dietary supplements, recreational drugs like marijuana, social drugs like tobacco and alcohol, or other drugs. Like, I'm saying that caffeine technically is a drug. If you are addicted to caffeine or energy drinks and you have high blood pressure, your doctor wants to know about that. Basically, anything you ingest through your mouth, inject into your body, or apply to your skin, like prescription strength deodorant or hormones, it needs to be shared with your provider. There's no gotcha moment coming up here in your future if you tell them, just tell your provider. If you don't tell your provider, for example, that you take birth control pills and you smoke, they can't tell you how that combination affects your risk of heart disease or stroke. You should also tell your provider about your allergies, especially drug allergies, but any other allergies like bee stings, peanuts, anything that may be life threatening if you consume. I'll tell you a quick little story. I developed an allergy in my adult life. I didn't see this coming, but I was donating blood for the American Red Cross, and I found out that I'm allergic to their new antimicrobial scrub. It's called chlorhexidine. There used to be iodine products for the scrub for the American Red Cross. It left this brown mark on my arm, and I noticed they were using something clear. I got a red bumpy rash when I got exposed to chlorhexidine, and that's important to know because chlorhexidine is a very common antimicrobial scrub here in the United States. I have had to disclose it, and people have tried to use it on me, and I have stopped them. So, your providers need to know about your allergies. If somebody comes at you with something that you're allergic to, speak up. Your providers also need to know about your vaccination history. Even if you just print off your history from a different health system's patient portal, you need to keep a copy of it and share it. Keep it updated too. You might need a tetanus shot or you might be due for some other vaccination. Your provider will not know to have that conversation with you unless you provide that information. Be a good patient, have your vaccination history. And if you do not believe in vaccinations, share that with your provider. Providers also need to see a list of the other healthcare providers that you've seen, in my opinion, at least in the last 5 years. It would also be helpful to provide the last date that you saw them and why you saw them. Here's an example for you. Once upon a time, I had to see a podiatrist to get orthotics made for my shoes. I had plantar fasciitis from standing on my feet as a pharmacist for years, and I needed orthotics. If I went to a new provider, they might want to know why I was going to a podiatrist and why I needed orthotics, because someday they might have to deal with my plantar fasciitis again. Healthcare is like an onion. You may think that one layer is meaningless, but you can't anticipate how your provider will feel about it because they might want to look at it from a different layer of your onion. Having an accurate health history leads to good care. That's the bottom line. So disclose what you can. We all know how fun it is to fill out those new patient intake forms or type them out nowadays. I guess technology has really come far. You can just type things out. But if you don't have all the answers kept from a running record, you might struggle to fill out the paperwork or the form online. I keep a running record of all of this stuff, and filling out forms is a breeze. Your providers also need to know about your surgeries, so we'll move on to that. Ladies, this includes C sections and hysterectomies. Men, of course, this includes a vasectomy. Any gender, you need to let your provider know if you blew out your ACL in high school and had to have it repaired. Did you have your eyes surgically corrected? I think they call it LASIK surgery. Have you had moles removed by a plastic surgeon? Did you have your tonsils removed as a kid? Did you have your appendix removed? Any other organs, like maybe your gallbladder? Your surgeries may have been decades ago, but your provider doesn't know that. So just fill them in on the details. They're meeting you for the first time. If it's, you're coming to our city from somewhere else, just fill them in on the details. Also, you need to let your provider know about any other procedures you've had, like a colonoscopy at age 45, your annual pap smear, your annual mammogram, recent blood work, etc. If you are a woman and your primary care provider, is meeting you for the first time, they may ask you about this stuff. So try to have the date of your last pap smear or mammogram ready to go in case they ask. I am pretty sure they will. I would also recommend that you share your hobbies and interests with your primary care provider. I know this is not medical information, but listen, if you're trying to stay healthy, your primary care provider might be interested in knowing why you're motivated to be healthy. They might want to know if you're raising a young family and you'd like to be healthy so you can give piggyback rides. Or maybe you're a teacher who takes every summer off to go on trips with friends or RV trips with your brother, whatever it is. Or maybe you're trying to see every baseball stadium in America. Maybe you're retired and you've got grandkids that you want to see graduate from high school in 18 years. Let your provider know what your goals are. Or maybe you're a triathlete who needs to stay competition ready. Maybe there's something that they can do to help you. They can help you stay healthy, but if you have an injury, they can refer you to physical therapy and anything else that you may need. Tell your provider your story. It sets you apart from all their other patients, and it lets your primary care provider see your humanity as well as the technical stuff that I talked about already. That does it for everything that I would keep track of in a binder or a notebook. If you can think of anything else that you need to keep a running record of, be my guest. Once you see your PCP, be responsible and follow up with anything that was recommended. This is where a binder or a notebook can really help. I personally like using a notebook and I write down what we talked about and what I'm supposed to do about it. If it's an annual well check, it's usually just, follow up with the mammogram or schedule an appointment 1 year from now. Come back when you're sick. That's pretty basic, but yours may be a similar plan. So keep track of anything that they have said that you need to follow up on, whether it's blood work, a referral, or something else. Just keep track of it, write it down, and then follow up. And I know how hard it can be to follow up, by the way. I've been there. If I don't put appointments on my calendar, they don't happen. I need to schedule my annual eye doctor appointment, my dental checkups, or my mammogram really far in advance and then put it on my calendar. Otherwise, I'm not going to do it once that day has passed. I need to plan. Even if it's not for 6 months or more, I just do it as soon as possible. Otherwise, time slips away from me. Unless you have caregivers taking care of you or advocates working for you, no one's going to do this for you. So be a good patient. Follow up with anything that is recommended. I know it sounds like I'm on a soapbox as I'm talking about this, but I know how to be a patient in Perrysburg, and I think this may help you for me to talk about this. Part of being a patient is showing up for yourself so you avoid health problems or address them when they come up. I am not trying to get on my soapbox. I'm just telling you how to be a patient in Perrysburg and how to get the most out of your healthcare. More than 10 years ago, I'll tell you a little story. My sunscreen free childhood in Pemberville, Ohio, caught up with me. I was a lifeguard at an outdoor pool for 2 summers when I was a teenager. I think we used Coppertone 4 or 8 back then. It was much different from what we have now. Long story short, I didn't wear sunscreen on my ears and I wore ponytails. My ears got fried. Even through adulthood, I don't remember putting sunscreen on my ears, and it caught up with me. Guess what happened? My dermatologist found a series of funny looking moles. I think there were 4 of them, 4 moles on my left ear, and I had to do something about it. I had myself a little cancer scare. I had to go to a plastic surgeon because the place where the moles were on my ear were not something that a dermatologist could address in her office. So I had some moles removed along with a little chunk of my left ear, and then they sewed it back together. In the end, the moles were not skin cancer. I'm lucky, but I'm glad I looked into it. If you ever have a skin cancer scare, I recommend that you get it checked out right away too. But first, you have to have providers that you can go to. So have the providers and then show up for yourself. If one of those providers says there's possibly some skin cancer here, take care of it right away. I know you want to live your best life here in Perrysburg. There are a lot of healthcare providers here in Perrysburg who can help you. Whether you're planning to move here or you've been here for a while, take care of yourself. Next up, let's talk about what do you do when you have an emergency? How do you deal with emergencies in Perrysburg? The good news is there are options in Perrysburg. Now, I can't triage your emergency for you clearly, but I can tell you what your options are. We do have EMS, emergency medical services, here in Perrysburg. So if you're having chest pain or heart attack symptoms, call 911. Someone will show up and help you out. If there's something less life threatening, head to the emergency department. We have one hospital with an emergency department here in Perrysburg. It is called Mercy Perrysburg Hospital. We also have several urgent care centers here in Perrysburg. You could try one of those. Now, if you do have a primary care provider and you feel you have an emergency while they're open, you could call for a same-day appointment or ask, do I go to an urgent care center or an emergency room? They may be able to help you with your decision-making. I know how hard it can be when you're having an emergency and you're freaking out and you're not sure where to go or what to do. It's part of being human. And also, another idea, kind of an out of the box idea for something that you may consider an emergency, you could try telehealth. This is not for an emergency where, you're having a heart attack, but if you feel you have a personal emergency, you could try telehealth. Having a PCP is very helpful. You can talk to them about emergency preparedness. Go over some scenarios, kind of like tornado drills in elementary school. Talk about what would happen if you had chest pain. If you're sick during office hours but you don't have an appointment, can you get a same-day appointment? How do you do that? If you can't get an appointment even though the office is open, do you go to urgent care or the ER? Or is telehealth okay? Under what conditions is telehealth okay? Your PCP can give you ideas about what to do. It's very good to have a plan before you need it. I know I don't have to say this, but you probably already know that the healthcare system in the United States is complex. It is hard to know where to start and how to pay for things. There are a lot of options, and it takes time to research those options, and the onus is on you. It can be hard. Some people get overwhelmed and give up. They use urgent cares and emergency centers as primary care providers. That doesn't have to be your story. Use what you've learned today to help. Let me just sum up the landscape here in Perrysburg, the medical landscape. Perrysburg has primary care providers. If you need one, you can find one. We have mental health providers, we have urgent care centers, we have a hospital with an emergency department, we have eye doctors, dentists, chiropractors, and a number of allied health professionals like physical therapists, occupational therapists, speech therapists, massage therapists, and more. I can't even name all of the providers that we have here. The point is, if you're moving here from out of town, we likely have the basics here for you. And if you need a specialist, you may just need to drive to Toledo, which is not too far away, or Detroit, Cleveland, or Columbus. This town should have your basic needs covered. As far as finding a provider, whether it's a primary care provider, a concierge doctor, an OBGYN, or another provider, you need to do your research. If you already have a PCP, you can just ask them for a name. But I would also do some due diligence if I were you. Look that person up on the medical board's website, whether it's a doctor or a nurse, verify their identity, make sure they're not facing disciplinary action, and also consider asking your family, friends, and neighbors if they know that provider and what they know about them. You can also look to the Perrysburg, Ohio Facebook group for some help. We have a Perrysburg, Ohio Facebook group in this town with more than 20,000 members. You can always ask for a recommendation, like who do you recommend for an OBGYN or a hospital to have a baby or a PCP? You don't have to take their advice. But if you like what they're saying, you could single somebody out and say, "Hey, may I please message you and, we could have a conversation about this." If you're new to town, you have the opportunity to talk to people who live in this town, and we will try to help you out. But I do get how, if you're not from here and you're new to town, this sort of thing might make you feel uncomfortable. So take it with a grain of salt, take it or leave it. You don't have to take my advice, but it is a source of information. I will caution you against using social proof online as the only reassurance that you need. Sure, it's great when somebody has 1,000 five-star Google reviews. Yes, Google reviews can be nice, right? I get how that kind of social proof can be really reassuring. But just don't let that be your only research. You also have the option to call the provider's office, ask for information from the receptionist. Maybe the provider even does a no cost or a low cost meet and greet appointment. That could be great. Back when I was in high school, my parents set up a meet and greet with our new PCP. That was around the time that I graduated from high school. He was from Canada. He had just moved to the United States. And even though I was an older child, I was still wary of strangers. I appreciated the opportunity to do the meet and greet appointment because, let's just face it, this is a person that you're going to be telling some very personal things to, and you want to feel them out before you end up going to them for years to come. That's just my story. The meet and greet appointment earned some trust, and that doctor was my doctor partway through college. If you're looking for a new OBGYN, PCP, or other important provider, consider going deeper than Google reviews. Maybe call the office, do a meet and greet, get some information from your family, friends, neighbors, and who knows, people that you've just met on Facebook. You want a licensed provider with a clean record with the state board of whatever, nursing, medicine, etc. You want a provider with confidence, experience, empathy, and beliefs that align with yours. If you believe in Western medicine, for example, choose accordingly. Keep your payment method in mind as you choose your providers. Medical insurance companies, I know they sometimes dictate who you can see. Keep that in mind as you choose your providers. And remember, the concierge provider is an option. We're about to wrap this up. We talked about moving to town and finding providers. A lot of my comments could be used to help you find a provider if yours has moved or retired as well. We talked about how social proof is nice, but remember to consider the facts that matter as well. Stay in your lane as a patient and be clear on what you want, whether it's an annual checkup, a sick call, or a new health problem. Be a good patient, and I wish you the best on your health journey. There's a lot more that I could cover, but I will stop right there. I would like to recommend a book as I close this out. The name of the book is How to Be a Patient: The Essential Guide to Navigating the World of Modern Medicine by Sana Goldberg, RN. I read this book this week, right before I recorded this episode. I was looking for some inspiration because healthcare in America is very complex and I don't want to overstep my bounds as a pharmacist. So I hope you understand that the angle of how to be a patient was what I went with. The author in this book that I just mentioned, How to Be a Patient, does a really good job talking about how to be a patient and get the most out of your healthcare here in the United States. Even though it was published back in 2019, it is still relevant here in the year 2025. And that's all I have for you today. Thank you for listening to episode 98 of the Perrysburg Podcast. Please visit perrysburgpodcast.com to read the show notes. In the show notes, you will find a link to part 1 of this series, a link to the clinic at the Perrysburg Heights Community Center, the Perrysburg, Ohio Facebook group, and the book that I just mentioned about how to be a patient. If you would like to be notified by email each time a new episode of the Perrysburg Podcast comes out, go ahead and sign up for the newsletter on perrysburgpodcast.com. You can also subscribe to or follow this show on your favorite podcast player and YouTube to get each new episode right when it comes out. Share this episode with anyone you know who might like to learn about how to be a patient in Perrysburg, Ohio. I thank you for your time today. Thanks for listening, and I'll talk to you next week.